All right. Good afternoon, everyone. Dr. Jared Erdmeyer here. Proud to be here with Cheryl New from True Health Medical, Chief of Clinicians. So, as you know, we're here today to talk about regenerative medicine, which really is what we're talking about today is stem cell therapies, mostly at this time for extremity joints. So knees and shoulders, elbows, fingers, ankles, hips, things like that. But I want to tell you just a little bit of a backstory here. The reason we're even coming to you today to talk about this is because this cutting edge treatment has the ability to improve your quality of life, avoid surgery, and often undo some of the wear and tear that has been created in your joints over time. Regenerative medicine or stem cell therapy is the only thing that I'm personally aware of that has been shown to actually regrow cartilage or be able to regrow tissue, and it's your body healing itself. We first sought out this style of treatment, not necessarily for something that we were even going to bring into the clinic, but more because we found that people that wanted to live a more holistic lifestyle, including many family members of mine, needed a better alternative to surgery when they were having joint pain. So, as we go through this today, I just want to tell you essentially how to have access to it. So should you watch the whole seminar and decide that you want to move forward with having one or multiple joints assessed, what you do is you call or email the clinic, and it will be $50 to have one or two joints assessed, or $100 to have three or more joints assessed. And so just know that, like I said, we'll give you more details at the end, but ultimately the idea for you learning about this is to find out if this is right for you. So just to tell you a little bit about True Health, I always use the example of if I'm driving to Chicago, we see billboard after billboard about stem cell therapy or regenerative medicine. And one of the things that can sometimes make people nervous about it is really not understanding the quality. So the reason that we are partnered with True Health is they are a full medical organization where they have, medical directors that have, 30 years experience in the hospital system, teachers, they own their own labs. So you know exactly where you're getting the stem cells from. They're from the exact right source. And they have people with 20 plus years experience in the field of what would be considered a fairly young industry in modern medicine. So Cheryl's with us today, as I mentioned, Chief of Clinician. She has over 19 years experience. And instead of trying to tell you about her, I'm just going to have her tell you a little bit about her.
Thank you, Dr. Jared. I'm privileged to be here on this webinar with you, as well as partnering with your clinic. We do have an incredible team surrounding True Health that it does include MDs, PhDs, compliance people. We are well-rounded and well-versed with many, many years experience. A little bit about my background. I am Chief of Clinicians, meaning I come into the clinics and help educate and train. That's something I really enjoy doing. I began my career actually about 22 years ago as a research scientist. I have a master's degree in molecular biology and was actually doing gene therapy protocols at Indiana University Medical Center, where a lot of our studies were going into clinical trials. It was very exciting for me. I was able to work with patients, and that love was a love that made me decide to go on and get a second master's degree as a physician assistant. So I have also been practicing clinically now for 20 years. I've been in emergency medicine, orthopedic medicine, plastic surgery, and then also regenerative medicine. So I have also a diverse background, which allows me to, again, come into the clinics, help to educate and help to train. And then if there's, other scientific backgrounds I have around me with my medical doctors, they're wonderful resources that we enjoy bringing regenerative medicine to the clinics. So with that, I'll let you start the seminar.
Sure. So here, if you hear the word stem cell, what you really, I guess, would think of is stem cell is your body is the goal of a stem cell is for your body to heal itself. It's using your own innate intelligence to develop or to heal an injured area, and that's done through what they call an undifferentiated cell, which Cheryl's going to go into in just a moment, turning into what your body needs it to turn into to heal. So when you think about the field of regenerative medicine, why does it need to regenerate? It regenerates because something's damaged. It's inflamed. In most cases, it's causing pain. It's wearing out. And so as we age, those things are more prone, but especially if you've had an injury in an area, you may be more prone to having that happen over time. And while there are certain things that are even more conservative that you might try first, if you've gotten past the conservative things that are non-invasive whatsoever, long before I would ever personally do cortisone or even consider surgery, regenerative medicine is such a great spot to be because it can do exactly what we just talked about, allowing your body to heal itself.
So that's a great introduction to regenerative medicine. And let's focus on what are stem cells. So stem cells are an undifferentiated cell, which means they have the ability to respond in the body to what's going on. So we naturally regenerate our body on a regular basis. Our blood cells are regenerated, our skin, our stomach lining. These are the master cell that has the ability to regenerate, but then also to heal and respond to what kind of injuries or trauma are going on in the body. So think of that as the master cell. The specific type of stem cells that we are looking at for the orthopedic realm are the mesenchymal stem cells. So these are the stem cells that ultimately will help your body when it comes to repairing injuries like muscle injuries, cartilage damage, bone, fat. They are, again, ability to reduce inflammation that might be going on in the body. And these are the type of cells that we are focused on when it comes to again, regeneration in the joints. Now, a lot of people will hear about autologous stem cells or taking your own stem cells. And this is an important point because this is where a lot of things get confusing. If we are taking your own stem cells, we are basically getting them either from your bone marrow or your fat. So this is something that I actually went through when I was a scientist. I was a bone marrow transplant. They took exactly like this picture, a large bore needle, put it into my iliac crest, and took out about 60 cc's of bone marrow from me. So this went through a procedure. The risk that go with this, certainly I was in pain for a number of days. There is always a risk of downtime. This can be expensive if this is something that somebody chooses to do. But one of the big points to drive home here is the potency, the variability, and the age dependency. As you age, your stem cells also age. And this is something that, as we know, we just don't heal as well as we get older. Let you go on to the next slide.
So, yeah, so when you said that, I think one thing that a lot of people may not realize is almost everybody that watches this has heard of stem cells before, because people when they have cancer treatment, you hear about a bone marrow transplant. A bone marrow transplant is because the chemotherapy or the cancer treatment kills so many other things as well that they pull bone marrow, which is full of stem cells, out of your body and inserts them back in because they can self-replicate and repair. But like you said, unfortunately, the older you are, the less effective it is.
Yeah, so I know Dr. Jared likes this slide, and I think people can relate to it better. We are looking at stem cells from umbilical cords, and I'll talk about that in just a second. So the slide represents, as a newborn on up through as we age, the level and the numbers of stem cells traditionally in our population. So go ahead, Dr. Jared. I know you like this slide.
So this was probably when I first was researching this is what really took hold for me of like understanding why would someone need to use stem cell therapy or regenerative medicine as they get older. And just in case you're watching this on your phone or on a screen where it's hard to see, when you're born, your body is chock full of stem cells. In fact, the ratio is 1 per 10,000. So you have an undifferentiated cell for every 10,000 cells in your body. And when you consider that there's, trillions of cells in your body, that's lots and lots of stem cells, which is why, even when you're a teenager, there's 1 per 100,000. So when you hear people say, like, I got hurt in high school and it just seemed to heal on its own. Well, part of that is your body's more able to self-heal or repair when you're injured at younger ages. By the time you're 35, that's gone down to all the way at 1 in 250,000. If you're 50, it's 1 in 400,000. And by the time somebody's 80 years old, it's 1 in 2 million. And so if I can give you just a couple examples of people that I know that have utilized this, my grandmother, when she had this done last year, she was 81 years old, had MRIs in both shoulders, and they said, there's nothing we can do for you. You're never going to be able to put your hand behind your head again. Your muscles are completely deteriorated. The tendons are frayed. You have major arthritis, and you're just going to have to live with it. On top of that, she had fallen and had injuries in both knees, but the one knee they said had to have a knee replacement as soon as possible, and the other one that would likely need a replacement within the next year or two, all based on how little cartilage was left and the meniscuses were nearly gone. And so you think about how is her body ever going to repair that? But upon adding in these mesenchymal stem cells, she was able to move her arms behind her head again. Her body was able to repair enough. The grinding in her knees completely stopped. And she had dramatically got down to from, 8, 9, 10 out of 10 pain in her knees down to 0 or 1 out of 10 pain in her knees. And then, so that's somebody who's, quite a bit advanced in age. One of my best friends, who is also a chiropractor, he was a, college wrestler, and had 3 meniscus surgeries in his teens and 20s. So even though maybe he was younger and it could have repaired more, having a medical doctor cut all that, meniscus out, he started to train for a marathon and couldn't even run a mile some days because of the severe pain. And then Cheryl, obviously you know this, but you did a stem cell therapy for him, and it's I believe 2 years later now, 2+ years, and he was able to climb a mountain, run a marathon, do the things, all because it just gave the body it's what it's already trying to do to repair it. But the older you are, the harder that is. And so if you this slide alone is like I said, the one that just completely sold me on why this would be necessary, especially for adults and especially as people are aging.
So let's discuss a little bit about where our source of stem cells come from. So we are screening, and these are all volunteer women that have scheduled C-sections planned. They go through a questionnaire and a testing process, and able to donate basically the birth product after their baby is born. So this is the placenta, this is the cord, this is what otherwise would just be thrown in the trash. So the important thing to know is that a lot of people are concerned that babies are harmed or these are embryonic stem cells, and they are not. These are considered adult stem cells once the baby is full term and the baby is born. Now, what they do is they take out the red blood cell component, which is where the HLA matching comes into play. So basically, anybody can get these stem cells. They are, again, completely undifferentiated. They don't have allergic reactions or adverse effects, and anyone can get them. I'll let you go on. So this is how they're basically obtained. Again, once the C-section is scheduled, there's a team there that collects this product. It is taken to our labs, and our labs are all FDA approved and certified by the American Academy of Tissue Banks. So this is where the cord blood product is processed, filtered, and then cryopreserved or frozen down until ready to use. So one correlation I like to make is if you had an accident or injury and needed to go get blood from the hospital, This is the same type of facility and labs that screen that blood at the hospital. And again, we don't usually go in and say, wait a minute, is this blood safe or tested? We assume, we hope, and we know that the FDA has standards and regulations that's put on this type of a product when we get it from the hospital.
Right. And, sure, you mentioned that the FDA approval and the FDA lab, that was one of the things, and I probably should have said it earlier, but upon researching, there were quite a few labs and quite a few companies that is not the case. So the certifications, I guess, that True Health has is one of the things that really drew me personally, and why we feel so confident to do this with family, friends, is that, so sure, could you talk just briefly about, the fact that your labs are all the FDA, part of it, and why that's uncommon or not necessarily required in the stem cell world?
Sure. And if you want to go on to the next slide, this also correlates. So obviously the biggest concern is safety. And we all want that for the product. So this is where, again, the labs go through certain certifications for standardization and sterility, as well as testing. So the product does go through 14 different tests to make sure they're safe and screened. And then the lab goes through additional testing for bacteria, fungus, endotoxins. They go above and beyond the standards of what are put across the board. So that's where, again, we feel that this is one of the best products out there. We feel that it's a very safe product to use because of these additional standards that they go through. So basically, people kind of want to know, and they don't always understand what is actually in the product. So besides the mesenchymal stem cells, which are actually only one of the components, the important thing to know is that there are cytokines, which are actually signaling systems. So the stem cells can respond to the body that has many different signals to indicate what it needs. If it's trying to heal an injury, if it's trying to create new blood flow, there's a lot of different signals that these cells respond to. Something called hyaluronic acid is actually the cushioning in the joint. So a lot of people, if they had just a little more space or a little more cushion, could relieve a lot of that pain. And these stem cells create their own hyaluronic acid. They're, again, coming in to decrease inflammation. So much of what's going on in the joint is this chronic inflammation from injury, from continuing to, wear away the cartilage. And these are the ability to help your body not only just repair cartilage, but also to create hyaluronic acid to respond to the signals that decrease inflammation. So there's actually a lot that's going into our product.
Yes. And if I could talk for the less sciencey people for just a second, when we were looking at this, and when I had another doctor explain this to me, one of the ways that he explained it was like scaffolding with construction. When you think about all these growth factors and different things, it's like you want to build a whole infrastructure within that. And although we want to build it, ultimately the body is what builds it. So these other things, the quality that's in there, the growth factors, that's what helps these things continually replicate. So it's not just what you have injected into your joint, but more importantly, how they're able to be supported, grow, multiply, so that you really get the best possible outcome. So we've talked a lot about what they do. I'd like to explain for just a moment, the treatment process, or really just how it works. So first of all, you need to make sure you're a good candidate. So what do I mean by that? The most common candidates for stem cells in these extremity joints is somebody who has anything from tendonitis to deterioration to small tears, soft tissue damage in the joint. Ultimately, that can be assessed through a series of orthopedic testing. We can look for some of the arthritic changes in an x-ray. There are some people who do bring in MRIs or old MRIs, like treatment reports. But ultimately, what we need to first figure out is, are you a good candidate for the process? Do you have a high likelihood of success? And one of the things that I want to make sure and differentiate is, yes, there are many, many people who see significant benefit when they're, let's call it like bone on bone in their knee or hip but those people that are having discomfort and don't necessarily have a solution, but aren't bone on bone, might be even better because there's more to work with. There's more for your body to respond to, and we've seen some really cool things with all the people that we've treated by this point. But ultimately, the process is you first need to come in and figure it out. So for that, how that works is, if you're sitting here and you know that you'd like to be assessed, you either call and schedule an appointment with the clinic, send us an email, or when you're in for one of your adjustments, for those of you that are current clients, you let us know. We're going to take a series of x-rays depending on what joints are needed. What I do is I collaborate with Cheryl on, what's going on, what we think you need, the recommended dosages, confirming that you're a good candidate, and then we set you up for a follow-up appointment where I'll go through your x-rays, we'll go through and test your joint, we'll go over the recommendations that we've pre-discussed, and then we go over the pricing and schedule for treatment dates and all that kind of stuff. What actually happens internally when you talk about the advantages, when you're talking about fluid-filled joints, which are the ones that are in your extremities, like knees and elbows and hips and shoulders and all that kind of stuff, what Cheryl does when they're in there, what they do is they inject the stem cells as close as possible to the actual damaged part. And what the stem cells do is they actually attach, or they have an affinity for the areas that are more inflamed. And so they go to that area and start to help the body repair that area. She mentioned that they're more potent or more effective than bone marrow or fat because they're from that umbilical cord blood, which is really that 1 in 10,000 versus the 1 in 400,000 or the 1 in 2 million. And the other nice thing about this is it's not having to take them from your body, so it's not a multiple procedure, and it's just one of those things where it works more effectively in most cases. So these are the areas that currently are, I'm going to say, allowed to be treated. So like I said, and I'm just going to repeat them all. So shoulder, knee, elbow, hand, foot, hip. There are places that can do the back, but it's much more complicated. So currently we are not doing spine, but new this time, you do have the potential to do hip. Which is really cool because there's a lot of people that have reached out or requested about knowing that they have hip arthritis and want to prevent or reverse that. Now, this slide here, when you talk about what are stem cells for, stem cells are not just to repair damaged joints or soft tissue. There's more than 5,300 research studies currently on record for all sorts of things, from autoimmune conditions to digestive ailments to, anything you think of. Asthma you can see on there. But in fact, I was first introduced to stem cells not from a joint perspective, but actually when we had our first child, there was a big sign in the OB's exam room when I was there with my wife that said, would you like your cord blood saved? And I actually asked him, because I was like, I've never heard of this before. He said, well, there's so much research right now on genetic conditions, and they think that the answer is going to be using the body's ability to heal itself. So for your children, let's just say hypothetically they come out with some weird genetic condition, you would like to have their own stem cells available for them. And so I paid, it was several $1,000s, and all they did was, instead of throwing the cord blood away when my wife had our first child, they saved it. They sent it off to a lab, and it's sitting in a lab that's frozen, and we paid for it to stay there for the first 25 years of his life, because there is so much research being done on healing all sorts of conditions, whether it's degenerative or autoimmune, like I said. So just remember, what we're talking about is what's available right now, but there is so much research being done because this is really cutting edge in all arenas. So here's really the question, since this is a message. If you post a question in the comments section here when you're watching it on Facebook or on YouTube, we will respond to you either on the message or send you a private message. But here's some of the most commonly asked questions. So first of all, when she talked about safety, I thought Cheryl did an awesome job talking about, really, are stem cells safe? With the fact that they get the red blood cells out of there and they're undifferentiated cells, they are overall a very safe interaction. In fact, for most people during the treatment, they feel minimal or in many cases no pain whatsoever. Cheryl, do you want to handle a couple of these?
Sure. So one thing that we do is we assess everybody as an individual. So when you are looking at this as an option, we're going to look at your medical history, which is important for me to assess what medications you're on, what's in your medical history, but also to look at your hobbies, the things that you do for work. And we take all of that into consideration with the amount of downtime that you might need. We go into this with the idea that hopefully one injection is all that you'll need, but it is a safe procedure that we could repeat. So one thing that we will do is, after we have any assessment or clearance or whatever we need to do and we do the treatment, I will give you guidance on the recovery process. And even though there may be some minimal downtime, it's so much less than what somebody would have if they had to have a joint replacement. So we may, have you back off for a few days or even a few weeks if there are certain activities that we just want you to be cautious about. So one correlation that I've used frequently that people tend to relate to is, think of in a joint, if we are planting grass seed and the little seedlings are starting to grow, and the last thing we want you to do is to feel pretty good and go out and play a big football game on this grass seed and tear it up again. We want things to start to work and start to heal and start to have the body respond. And so we may just have you back off a certain type of sport or an activity just for a short period of time so that we can allow for the healing to start to occur. I don't know if you want to add to that, Dr. Jared.
Yeah, so I mean, this is one of the more common questions when people are trying to find the right timing. But if you like to walk or exercise or that, I mean, there's very minimal. Typically, the downtime is if you do like a sport where there's a lot of pounding or a lot of cutting. So long distance runners, basketball, soccer, I mean, those things, I believe you said, come closer to like anywhere from 4 to 8 weeks. But a lot of times, you're talking about downtime of a week or two, and that downtime isn't limiting. It's just you have to be careful not to pound on it too hard or too long. Additionally, when you talk about how long does it last and how fast do I see results, I'll tell you one of the cooler experiences. So we have True Health in about every 4 to 8 weeks, depending on what's going on. Pre-COVID, it was about every 4 weeks. We've spread it out a little bit just because of all that's gone on. And one of the people who's already signed up for July 24th, the next time that Cheryl's in the clinic, the reason he's already signed up is because his brother-in-law had the procedure 6 weeks ago and was doing so well after the first couple weeks that he recommended them, and he wanted to do it as soon as possible. But how fast we've seen people have results as early as 4 days. But you do have to keep in mind, like Cheryl said with the grass seed, those cells will multiply or grow for 3 to 6 months after the procedure. So, I always tell people, as much as I tell myself not to be, I'm so emotionally invested in you getting improvement. I'll start asking you the first week or two, like how it's going, how much difference you feel. Ultimately, you can feel a difference within the first week, but sometimes it does take several weeks for those to really get that grass seed growing. And like I said, they do multiply for 3 to 6 months, and then they last as long as they. Basically, it's based on how fast you wear them out, or if they're able to last for decades, which is a possibility.
One thing I like to reiterate too is we see people of all different levels of degeneration, obviously of all different age groups and categories. And this may be something, and I've heard this time and time again. I've had people say, you have given me so much back as far as a quality of life. So if I could get somebody, even 50% better, but they're sleeping better at night, they can sleep through the night, they can walk up and down stairs without a constant pain or a constant clicking. They can ride their bike again. It can be such a significant change at different levels of percentages. Again, it may not be 100%, but and I've even had somebody tell me after 2 weeks that they felt about 20% better, but they followed up with that 20% means the world to me. And that is what we're looking for. Again, we can give you back many times a difference in your quality of life, which can be significant. Now, just on a personal level, I have had stem cells myself. I have what I suspect is a basilar thumb arthritis, and the reason why I suspect that is because I used to work for a hand surgeon that did a significant surgery when people had problems with the base of their thumb, and many times that has pain with everything you do with gripping and activity level. And I felt that symptom coming on. So I tried it myself. I had an injection over a year and a half ago in the base of my thumb. And I am a firm believer of how the change has happened even within my own body. I have gone on to treat many people on my team, also with the stem cells, and to see the significant change that it's had for each one of them.
So, it talks about on the next one about additional treatments. That's such a great question. And if I had a crystal ball, I'd love to tell anybody, like, this is how many treatments you would need. It's very similar when somebody asks me, how many chiropractic treatments do I need? How soon am I going to feel better? Of course, our goal is absolutely as fast as possible. Keep in mind, for most people that are watching this, it took years to get there. It takes time to heal. And as much as I would rather have it be a quick fix, we're certainly in a quick fix culture. Most things that are a quick fix have a lot of side effects. It's not the quick fix people think it is. So yes, you can, it's safe to do it multiple times. Then one of the things that somebody told me about this is that ultimately when you do it and you have more cartilage or soft tissue, you're less likely to need another treatment. The closer and closer you are to this bone on bone, you may wear that out more quickly because you just have less space to start with. But at the same time, and I might be jumping a little bit ahead but this is what I tell every person that asks me about, is this right for me? I always say, first of all, you should start even more conservatively. Start with chiropractic, start with physical therapy, give it a little bit of time, see how your body responds. If you have knee pain last week, you probably shouldn't just jump right in and do, stem cell therapy. You should see if you can get your body to heal itself. But ultimately, most people have tried that are looking at this have tried the most conservative route. But one of the major mistakes I see people make is to then turn around and go to an orthopedist and get shot up with cortisone, or to take a whole bunch of ibuprofen for 5 years. And because, those things, painkillers, NSAIDs, these strong Maalox came out, they inhibit growth factors. Not only is your body already having trouble healing, but it actually slows the healing even more, which can create less pain, allow you to damage it more, and it actually slows the healing. And so relying on pain meds for a period of time is really, for me, in my opinion, it's a very bad choice. Take it even worse, when you get injected with cortisone, one of the things that very few doctors tell you is that that's actually going to speed up the arthritic and degenerative changes in that joint. So if you have knee pain and you get shot with cortisone, sure, it's going to reduce the pain for most people for a month, 6 months, a year, 2 years. But really, that cortisone also, because of the drug class that it is, it makes the joint more brittle. So it makes it easier to wear out. It actually makes you more likely to have surgery at a younger age. And very few people know that until they've had multiple shots and they're in that make or break point where they don't know what to do. So when they say, like, is this right for me? try the super conservative stuff. But once you cross over into that cortisone or surgical realm, so you go beyond the cortisone, which is terrible for those joints, and then get to surgery. Well, if they cut pieces out, I mean, now for instance, with knees, with meniscus surgeries, I mean, the majority of research that you read shows that people have about the same outcomes with no surgery as do with surgery, because when you continually cut out that soft tissue, that space wears out more quickly in some cases. If you're 60 or over, there's a major research study that shows that having shoulder surgery only has an 18% success rate. So you just think about, like, these are not guarantees, and they don't not have side effects, where when you talk about regenerative medicine, very low risk, very high, outcomes, and, they don't have the side effects of the more traditional, more aggressive medical treatment.
So I'll add in also about the cortisone. Again, in the orthopedic practice I was in, we would limit how many injections we would give a patient because of exactly what Dr. Jared said. It does change the microenvironment of the joint, and it can damage and weaken your ligaments and tendons, which are your attachment points. It is simply masking the inflammatory response. So he said it perfectly. It could make you feel better temporarily, but when you feel a little bit better, you tend to go on and do more damage. So that goes to number 7, which is a big one. Why isn't my doctor recommended this treatment? A lot of times, again, doctors are going to kind of go for what patients know is that quick fix, which is that orthopedic injection of steroid. But then also think of these surgeons. It is their practice and their skill to operate on you. And that's what they know best. Now, stem cells are becoming a little more understood. And I think a lot of doctors will initially say they just don't know enough about them. But they are becoming a little more understood. But keep in mind that surgeon wants to operate because that's where his talent is, and that's what they're used to and accustomed to doing. And they try to do the best job they can. But keep in mind that those joints also have risk, they also have failure rates, and they also have longevity. So if there's a way that we can, again, preserve a joint, give you a little more of less risk, and certainly more longevity, that would be a great way to start before you would, in my mind, want to consider that joint replacement.
Right. Now, when I started with this at the beginning, but how do you see if this is right for you? It's very simple. You make an appointment, you have an assessment, you have x-rays taken. I'll just reiterate. So if you want to have 1 or 2 joints assessed, it's $50, 3 or more is $100. And what you do is you either call or email the office, you schedule an appointment, or for current clients that are chiropractic clients, you can let us know when you are getting adjusted that you'd like to also have a joint assessed, and we can take those x-rays right at the spot of your appointment. Now, due to timing, True Health will be at the clinic. It's an outpatient interaction, meaning that you're going to come in and you bring shorts or wear shorts. You're going to be able to walk in, you're going to be able to walk out, you're able to drive home. But what you do is the next time that they're here is Friday, July 24th, which means for anybody to be assessed, the very last possible day to be assessed is July 20th. And I would strongly recommend you make an appointment by July 16th in case there's any complicating factors that we need to sort out with any medications you're on or any supplements you're on, or really just need to send it off for more assessment to make sure you're a candidate. But like I said, make an appointment by July 16th, if possible, by July 20th at the absolute latest. I do want to put a comparison because Cheryl mentioned, joint replacement. Think about, just when you talk about cost comparison, when you have a joint replacement, on average, you're going to spend several $1,000s in your insurance between your deductible, your copays, and your maximum out-of-pocket costs. But that's not even the true price, because the true price is how much you're laid up. Most people that have joint replacements are limited in leaving the house or driving for at least a month. They often take 3 to 6 months to really be back in full swing. They may never be able to fully do certain stretches or mobility exercises ever again because it's an artificial joint. They're reduced from things like running or more physical activity because of wearing it out. But it's like, when I think of surgery, I think surgery is such a blessing in certain cases, but I also watch people have surgery thinking it's just the absolute answer without factoring in the costs of what it's going to cost them in their time, being out of work, being on short-term disability, not being able to go places or do certain things. You think about with joint replacements, anywhere from $30,000 all the way up over $70,000, depending on what joints or what type of surgery. When people come in here, it's typically a 30 to 60 minute treatment. They have follow-up visits or follow-up phone calls. We assess them in the clinic. They have minimal downtime. We have a few people take a couple days off work just because they want it to be the most successful possible, but you're not even required to take a day off of work. Completely different. And when you think about that, and cost wise, for the majority of people, it actually costs them less, even though it's not done in a hospital, or it's not it's not a $30,000 procedure and then you pay 20% of it or something like that. So with that being said, that really completes our seminar for today. Like I said, if you'd like to be assessed, all you do is call or email the office or let us know when you're currently here. This is not limited to clients of Chiropractic First or Integrative Medical. This is for anybody in the greater Rockford area, and certainly hope you learned a lot and benefited dramatically. And I want to thank Cheryl for taking time today to be on with me.
Thank you. Appreciate it.
Have a great day, everybody.